Today we are going to discuss the topic called as diuretics. Before entering into the actual topic, let us discuss few of the facts of the renal physiology. Kidney. Kidney is one of the major important organ of the urinary system. And majority of the filtration or the body fluids which are present in the body are filtered through the kidneys. And nephron is one of the most important organ, or it is a basic unit of the kidney where the filtration of the body fluids takes place. And the weight of the kidney is about 0.5% of the total body weight of the human beings. And the filtration, or the glomerular filtrate through which the Bowman's capsule is getting filtered, the cardiac output with which the heart is pumping out the blood, kidney receives almost 25% of the cardiac output. And the functions, let us see the basic functions of the kidneys. The functions of the kidneys are described in a 4-letter word called as BASE, B-A-S-E. B stands for the balance of the electrolytes or acid-base balance, or the blood volume or the blood plasma volume. And A stands for the activation of vitamin D. Vitamin D is one of the important vitamin which is essential for the human beings. And S, it's synthesis of erythropoietin and urokinase. Erythropoietin is a hormone which is used to increase the rate of production of red blood cells when there is increased oxygen demand. When there is increased oxygen demand for the body, then erythropoietin, it allows or it makes the increase in the RBC production. And E stands for excretion of urea and uric acid and creatinine. These are the waste materials which are to be eliminated from the body by the kidney. So these are the basic functions of the kidney. And whatever the filtrates or solutes which are present in the body, they have to get transported from the external source to the kidney. And the transportation is done mainly by two pathways, that is active transport and the other one is passive transport. Active transport is a transport where it utilizes ATP, that is energy form. ATP, the ATP is hydrolyzed to produce energy in order for the molecules to get transported into the kidney or into the nephron. And passive transport is such a kind of transport, it utilizes energies from the ionic molecules like sodium, potassium, calcium, etc. It utilizes energy from these ionic sources. And in order for the molecules to get transported through active transport, it uses two types of carriers. Because without any carriers, it can't get transported from one membrane to the another membrane. That is the reason sympaths and antipodes are the transport systems or transport carriers through which the transportation of molecules takes place in the kidneys. And the sympaths are the kind of carriers which travels in one direction only. For example, there is sodium sympath, potassium sympath. These are the sympaths which travel in the same direction. In the sense, the movement of molecules is carried out in a unidirection way. And antipodes are the carriers which carry the molecules in the opposite direction. In the sense, the direction or the movement of molecules is carried out in a two-way, that is in the opposite or antagonized direction. These are the two ways by which the transportation of solutes or solvents takes place in the kidneys. And the filtration usually takes place in the Bowman's capsule of the nephron. Though the pressure with which the molecules are filtered in the Bowman's capsule is about 20 mm of Hg. And through this Bowman's capsule, plasma proteins are only filtered. And the next thing is like kidney. Kidney also have few of the functions, or else the volume of the filtration volume through which Bowman's capsule, or the capacity of the Bowman's capsule is about 180 liters. In the sense, 180 liters of the fluid or plasma can be filtered through this Bowman's capsule. And out of this filtration, out of 180 liters of filtration, 99% is getting reabsorbed into the body. Only 1% is excreted as urine. That is about 1.5 liters out of 180 liters is excreted as urine. And kidney. When coming to the kidney it has arterial supply as well as venous supply also. The arterial blood flow in the kidney is about 1200 ml per minute. In the sense, in the artery, 1200 ml per minute of blood flow is taking place in the renal artery, and the plasma flow is about 650 ml per minute. 650 ml of plasma is flowing in the renal system per minute. And the glomerular filtration rate, the rate or else the Bowman's capsule, the filtration rate in the Bowman's capsule is about 120 ml per minute. In the Bowman's capsule, 120 ml of the fluid is getting filtered per minute. And there are various ions which are present in the kidney like sodium, potassium, calcium, magnesium, chloride, etc. And 99% of sodium, calcium are getting reabsorbed after the filtration. 99% of these ions are getting reabsorbed, whereas when coming to the sodium, only 85% of the sodium is getting reabsorbed. Remaining is eliminated in the form of urine, or it is excreted through urine. And before entering into the diuretics, there are few of the terminologies which are to be known, that is natriuresis, kaliuresis and diuretics. Natriuresis in the sense increased, when there is increased sodium excretion through the body, then we call that condition as called as natriuresis. Kaliuresis in the sense when there is increased sodium, when there is increased potassium excretion from the body, then that condition is called as kaliuresis. And diuretics are the drugs which promote the sodium and water loss in urine when there is excess, or when there is excess amount of sodium or water loss. The drugs which cause this is called as diuretics. And before entering into the category of the drugs, this is the structure or pictorial representation of the basic unit of kidney called as nephron. So nephron contains various parts such as Bowman's capsule, proximal convoluted tubule, loop of Henle. In the loop of Henle also we have descending loop of Henle, ascending loop of Henle, and distal convoluted tubule and collecting duct. It is very important to know the structure of nephron because diuretics act at various places of the nephron. And this is also one of the pictorial representation of the nephron. These are the site of action of diuretics. There are various categories of diuretics like carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors are the drugs which act at proximal convoluted tubule. And osmotic diuretics are the drugs which act at descending limb of loop of Henle. And there are thiazide diuretics which act at thickest part of the ascending loop of Henle. And there are potassium sparing diuretics which act at collecting duct, and there are loop diuretics which act in the loop of Henle, and thiazide diuretics which act at distal convoluted tubule. Renin-angiotensin system, RAS system. Renin-angiotensin. Renin is an enzyme which is secreted by the kidney. So aldosterone is a hormone which is, or else aldosterone is a substance which is secreted by the liver, and it is a potent vasoconstrictor. So this renin acts on the angiotensin, where it converts angiotensinogen to angiotensin 1, and angiotensin 1 is a potent vasoconstrictor. So because of this potent vasoconstrictor, it causes constriction of blood vessel, increase in the blood pressure. When there is increased renin secretion, or when there is increased amount of angiotensinogen in the body, there occurs sodium and water retention in the body. When there is sodium and water retention, indirectly it causes increase in the blood pressure. So that is the reason control in the renin-angiotensin system is also very important in the renal system. Diuretics. The diuretics act at various parts of the nephron. So there are various category of the diuretics like carbonic anhydrase inhibitors which act at the proximal convoluted tubule, and osmotic diuretics which act at descending loop of Henle, and thiazide diuretics which act at distal convoluted tubule, and loop diuretics which act at thick part of ascending loop of Henle, and potassium sparing diuretics which act in the collecting duct. Renin-angiotensin system. It is very important to know about renin-angiotensin system because renin plays a major important role in the proper functioning of the kidney, and renin is released by the kidney. And angiotensinogen is a substance which is released from the liver. So this angiotensinogen, when it is released into the body system, then kidney releases renin. Renin is a proteolytic enzyme which converts angiotensinogen, inactive form of angiotensinogen to angiotensin 1. Angiotensin 1 is a potent vasoconstrictor, and angiotensin 1 is converted to angiotensin 2 in the presence of angiotensin converting enzyme, and this angiotensin 2 has various actions like it causes increased vasoconstriction, it causes ADH secretion, it has increased sympathetic activity, and thereby there occurs disturbances in the body functions. So that is the reason it is useful to maintain the renin-angiotensin aldosterone system. Let us see the classification of diuretics. There are 5 classes of diuretics. The first class of diuretics are carbonic anhydrase inhibitors. So carbonic anhydrase inhibitors, it includes drugs like acetazolamide, brinzolamide, and dorzolamide. These are the drugs which come under the category of carbonic anhydrase inhibitors. So let us see the mechanism of action of these carbonic anhydrase inhibitors. Carbonic anhydrase is an enzyme which catalyzes the carbonates and H plus ions formation from water and carbon dioxide. So when water and carbon dioxide combines, it forms bicarbonate ions and H plus ions. So when these H plus ions are formed in the body, it gets exchanged with sodium ions through sodium and proton channel, and thereby there occurs increased sodium intake into the body and sodium retention occurs. So that is the reason when this enzyme is prevented, it prevents the formation of H plus ions in the body, and thereby it causes decreased sodium retention in the body. This is the pictorial representation where we can see how sodium and chloride gets exchanged and sodium and proton get exchanged, and how water and carbon dioxide is getting dissociated into the bicarbonate as well as H plus ions. The therapeutic uses of these category of drugs, carbonic anhydrase inhibitors, are usually used in the treatment of chronic open angle glaucoma, and they are used in acute mountain sickness, and sometimes they are used in epilepsy also. And these carbonic anhydrase inhibitors are usually given in combination with other diuretic drugs in order to prevent tolerance or in order to prevent resistance. And there are fewer side effects of these carbonic anhydrase inhibitors also, like it causes increased bicarbonate excretion from the body, where it causes metabolic acidosis. When bicarbonate ions are excreted from the body in large amount, thereby H plus content or acid proton contents in the body increases, causing metabolic acidosis. And it causes, when it is used in large amounts, it causes tolerance also, and it causes nephrolithiasis. Nephrolithiasis is a condition which is also called as renal stones. It means stones formation occurs in the kidneys. And there is another side effect called as paresthesia. Paresthesia is a condition where we can feel like pins or needle-like sensation under the skin. Under the skin we can feel like there's some pin or needle-like sensation which is causing clicking or itching nature. And there are other common side effects like drowsiness, fatigue, and CNS depression. The other category of drugs include osmotic diuretics. Osmotic diuretics like glycerin, urea, mannitol, isosorbide. These are few of the drugs which come under osmotic diuretics. The mechanism of action of these diuretics are, usually these diuretics act in the descending loop of Henle, and it causes differences in the osmotic pressure, or there occurs increase in the osmotic pressure. Osmotic pressure is a pressure which is exerted by the solute or solvent molecules during osmosis. Osmosis means the movement of molecules from higher concentration to the lower concentration through a semi-permeable membrane. If there is a concentration, or the concentration of molecules in one region is high, then the movement of molecules from higher region occurs to the lower region, but there should be a semi-permeable membrane. Through this semi-permeable membrane, the movement of molecules takes place. So the pressure exerted when these movement of molecules is called as osmotic pressure. So maintaining of osmosis condition is also very important in the body, because when there occurs osmotic difference or pressure difference in the body, there causes sodium or potassium retention in the body. Calcium and magnesium also gets retained in the body. When it causes retention, then there occurs water sodium retention, where it causes renal failure and other consequences of the renal system. So that is the reason maintaining of these solutes and solvents in the proper concentration is also important. So these osmotic diuretics, when there is any increase in differences in the osmotic pressure, then they allow increase in the osmotic pressure, thereby sodium or excess ions which are retented in the body are being excreted. And there are fewer therapeutic uses of these osmotic diuretics. These are prophylactically used in the cardiovascular disorders, or these are used in acute glaucoma condition also. And these are usually infused to lower intracranial pressure. In the sense, they are administered in lower intracranial pressure, and in short term The therapeutic uses of these osmotic diuretics include, these are prophylactically administered in cardiovascular disorders, and these are administered secondary to the trauma or in surgery conditions, and they are used in short term, and they are used for the short term treatment of acute glaucoma. There are fewer side effects also of these osmotic diuretics. When osmotic diuretics are given in increased concentration, then it causes cardiac failure. Sometimes it causes renal failure also. There are common side effects like headache, nausea, vomiting, and it causes hyperkalemia, that is increased calcium secretion out of the body, and it causes hypernatriuremia also. The other category of drugs are loop diuretics. Loop diuretics include drugs like furosemide, torsemide, ithacrinic acid, etc. So these loop diuretics usually act in the loop of Henle or at the region of thick ascending loop of Henle. So this is the site of action of these loop diuretics, and the mechanism of action of these loop diuretics include, they inhibit apical sodium potassium chloride transport in the thick part of or thick region of ascending loop of Henle. In the thick region of ascending loop of Henle, there is a sodium potassium and chloride channel where the exchange of sodium, potassium and chloride takes place. When the sodium is getting intake, then calcium and chloride will be excreted or they will be reabsorbed into the lumen. The mechanism of action of these loop diuretics. The mechanism of action of these loop diuretics include, they causes inhibition of the apical sodium, potassium and chloride transporter in the ascending loop of Henle. In the ascending loop of Henle, there is a port called as sodium potassium chloride port, where the exchange of sodium, potassium and chloride ions takes place through this port or through this symport, so through this antiport. This is a kind of antiport. In this sense, the movement of molecules will be in the opposite direction. The movement of sodium, potassium and chloride will be in the opposite direction in this kind of antiport. So when there is exchange or when there is more excretion of potassium and chloride through this antiport, then there will be influx of sodium more. When the influx of sodium is more into the nephron or into the ascending loop of Henle, thereby the sodium gets retented in the body, where it causes renal failure. So these loop diuretics, they inhibit this symport and they inhibit this transporter, this antiport transporter, whereby the more influx of sodium is prevented. When the sodium influx is prevented, then there will be no retention of sodium in the loop of Henle. And there are few of the therapeutic uses of these loop diuretics, like it is mainly used in the hypertension, it is used in hyperkalemia, it is used in chronic renal failure, it is used in edema. Edema is a inflammation of the tissue, and it is used in hypertension. Hypertension is nothing but increased in the blood pressure, and it is also used in acute and chronic hyperkalemia. Hyperkalemia in the sense increased calcium excretion out of the body. So these loop diuretics are used in the treatment of these diseases or the disorders. And pharmacokinetics. Pharmacokinetics in the sense, when these loop diuretics are taken in the body, what happens to the drug or how the drugs are getting absorbed into the body. So the pharmacokinetics, the loop diuretics are usually administered orally, and when these loop diuretics causes toxicity with cephalosporins. So we have to take care that the loop diuretics are not administered with cephalosporins and other antibiotics. And there are other drugs also, like ototoxic drugs, which when administered with loop diuretics, they causes contraindications or there will be increased toxicity of these drugs. And these loop diuretics have rapid onset of action. In the sense, when administered in the body, they show onset of action or they show immediate onset of action. There are side effects like hypokalemia. In the sense, they causes decreased calcium secretion or they causes calcium retention in the body, and they causes hyperuricemia, excessive excretion of urea and uric acid from the body, and it causes magnesium depletion. It causes magnesium depletion. When magnesium is depleted, it forms new compounds which when combined with bicarbonate ions. So when magnesium is combined with bicarbonate ions, then it forms a magnesium bicarbonate compound, which is not good for the body. So that is the reason this magnesium is depleted when the loop diuretics are used in higher concentration, and it causes metabolic alkalosis. The loop diuretics causes metabolic alkalosis. The bicarbonate ions are retented more when the loop diuretics are administered for longer duration. So when the bicarbonate ions are retented, then it causes metabolic alkalosis. And when bicarbonate ions are excreted in more concentration, then it causes a condition called as metabolic acidosis. The other category of drugs are thiazide diuretics. Thiazide diuretics include drugs like chlorothiazide, hydrochlorothiazide, benzthiazide, indapamide, etc. These are the drugs. Drugs like hydrochlorothiazide, chlorothiazide, indapamide, clopamide, etc. These are the fewer drugs which come under the category of thiazide diuretics. And the mechanism of action of these thiazide diuretics. Thiazide diuretics act at the distal convoluted tubule. So there is a transporter or a port which is present in the distal convoluted tubule called as sodium chloride port. So this is also an antiport where when calcium is where when chloride is excreted or when chloride is eliminated out of the nephron or distal convoluted tubule, then the influx of sodium takes place. It is also an antipode where the movement of sodium and chloride molecules takes place in the opposite direction. So when chloride is getting out of the distal convoluted tubule, then sodium entry into the distal convoluted tubule is more. Thereby it causes retention of sodium in the distal convoluted tubule. So these thiazide diuretics act by inhibiting this sodium and chloride port, and thereby the sodium retention is decreased. The therapeutic uses of these thiazide diuretics are used in cardiovascular disorders like hypertension, and these are used in congestive heart failure because when they allow the elimination or excessive sodium, they prevent the retention of excessive sodium in the body, thereby blood pressure is decreased. So that is the reason these are used in the treatment of hypertension and congestive heart failure, and these are used in osteoporosis condition also. Pharmacokinetics. When coming to pharmacokinetics of thiazide diuretics, these are also administered orally, but the absorption of these thiazide diuretics is low when compared to loop diuretics, because when administered orally they undergo first pass metabolism, whereby there occurs poor absorption of these thiazide diuretics. First pass metabolism is a kind of metabolism. Usually when drug is administered into the body, it has to pass through the GIT, it has to go through the liver metabolism, and thereby it is getting absorbed into the body. So when this first pass metabolism is observed for these loop thiazide diuretics, then the poor absorption is taking place. I mean, the drug which is absorbed into the body is very less, and the onset of action is also greater for these thiazide diuretics when compared to loop diuretics. Loop diuretics have rapid onset of action, but thiazide diuretics takes 1 hour to exert their action. And the T-half in the sense the amount of drug which is present in the body in the half time or the after the administration or half time of the half-life of this drug. The amount of drug which is present in the body after half time of the administration of the drug is called as T-half. So the T-half also is long or for these drugs, and it usually differs from different thiazide drugs also. But loop diuretics have longer T-half when compared to thiazide diuretics. And the side effects of these thiazide diuretics include hyperkalemia, and they causes increased sodium exchange in the collecting duct. So in the collecting duct, when these thiazide diuretics are given in higher concentration, then there occurs sodium retention in the collecting duct. So there causes, in the sense, the sodium exchange is done more in the collecting duct, thereby it causes sodium retention, and the volume contraction induced aldosterone release, in the sense when the volume or the filtration rate in the kidney is increased, thereby because of the pressure exerted by the filtrate in the kidney, there causes aldosterone secretion from the kidney. So these thiazide diuretics cause this kind of aldosterone secretion when used in larger amount. And we can also see hyperuricemia, hypernatremia, hyperkalemia. These are the fewer side effects of these thiazide diuretics when used in longer amount or when used in higher doses or for longer period of time. The last category of drugs are potassium sparing diuretics. So in these potassium sparing diuretics, we have two categories of drugs. One is directly acting and the other one is aldosterone antagonist. So aldosterone antagonists include drug like spironolactone in candrenone and eplerenone. These are the drugs which act by antagonizing the aldosterone. And there are directly acting drugs of potassium sparing diuretics like amiloride. And these potassium sparing diuretics, they usually act at the collecting duct. How the mechanism of action of these potassium sparing diuretics include the mechanism of action of these potassium sparing diuretics are, the name itself indicates potassium sparing, in the sense they give potassium instead of sodium. They eliminate sodium from the body and thereby the sodium is replaced with potassium. They give the potassium in place of sodium and the excess of sodium is removed from the body and thereby the potassium is replaced in the collecting duct. And these potassium sparing diuretics usually act at the collecting duct of the nephron. And the therapeutic uses of these potassium sparing diuretics, they are usually administered in primary hyperaldosteronism, a condition where excessive secretion of aldosterone is observed, because these potassium sparing diuretics are aldosterone antagonist. So they antagonize the action of aldosterone. So it is used mainly in the primer aldosteronism condition, and it is used in congestive heart failure also. It is used in cirrhosis in the sense destruction of any tissue. So they are used in the cirrhosis condition of the kidney also, and they are used in nephrotic syndrome. And the pharmacokinetics of these potassium sparing diuretics: spironolactone is orally administered and it is combined with thiazide diuretics. Spironolactone is always given in combination with thiazide diuretics for better effects or for effective results. And amiloride is also orally administered, but it is 50% effective and it is not bound to the plasma proteins. It does not bind to any of the plasma proteins and it is not metabolized also. And triamterene is also one of the directly acting potassium sparing diuretic. It is also orally administered and it is 50% effective. But this triamterene is 60% bound to the plasma proteins only. So that is the reason this amiloride is more effective when compared to triamterene, and it is also easily metabolized in the body. Side effects of these basic potassium sparing diuretics include hyperkalemia and spironolactone. Spironolactone has a special side effect called as gynecomastia. Gynecomastia is a condition where the development of breast is taken place or development of breast is seen in men. And triamterene also has a special side effect called as megaloblastic anemia. Megaloblastic anemia is observed in the cirrhosis patients. If a patient is suffering from cirrhosis, then if triamterene is administered in longer doses or in higher doses, then it causes a condition called as megaloblastic anemia. And amiloride has a side effect of increased blood urea nitrogen. When blood urea nitrogen is increased, then it causes sodium and water retention and there will be less urea excretion from the body. So that is the reason when amiloride is given higher concentration, the administration of amiloride in higher concentration is also not recommended. This is about diuretics.